A Global News exclusive report on military healthcare funding is getting the right attention tonight. The story was front and center on the election campaign trail and triggered the Alberta government to demand changes. Military brass are admitting the Department of National Defence shouldn't have made cuts to hospital healthcare payments without consultation. The Canadian Forces also made a major promise today that it won't allow a multi-million-dollar shortfall to happen. Our Ottawa Bureau Chief Mercedes Stephenson broke the story yesterday. She joins us now. Mercedes, because of your reporting, the military has acknowledged it made a mistake. What exactly are they saying?
The military is saying that they tried to do too much too fast, reversing a decision now to drop the rates that they reimburse hospitals at. Now, it's important to stop here, Robin, and to note that people in the Canadian Armed Forces don't get the same health care as those of us who are in the provinces. They're covered by the federal government. Now, they were looking at a situation where people were paying up to 5 times as much as interprovincial rates. And the military said, well, hold on here. That seems like a lot of money. Perhaps we can save some. It came from a position of trying to get costs under control. But what ended up happening is that the military unilaterally published rates, and that those rates were so low, they matched that of what the federal government pays for refugees. The provinces said that would not even begin to cover the cost. Now, the defense minister, who is running right now as a Liberal candidate as well, put his defense minister hat back on and spoke to Global News about this, saying that the reasons for trying to get this under control was that they feel the practices being used by hospitals were unfair. Here's what he had to say.
As it stands now, a member of the Canadian Armed Forces, when they get treated at a hospital, pays more for the service than a Canadian just because they wear a uniform, and that is wrong.
So the military healthcare system has been under significant strain, and they said, well, perhaps this is somewhere that we can cut. After all, military members and the Canadian military both pay into provincial healthcare with their taxes. It's not unusual for the federal government, who has responsibility for people like inmates, the Canadian military and the RCMP, to pay for their care. But this is just too much. So the effort perhaps coming from a place that made sense, but they're saying that the way that they went about it was the wrong way, and they will now continue to pay those original higher rates until they're able to come to an agreement with the provinces.
Okay, Mercedes, how are things changing now?
Well, we can tell you that as in terms of what's changing, some of the promises that are being made, Robin. First of all, money has been moved around inside the military healthcare budget as it faces significant pressures from things like increased requirements for mental health care and a force that has come back from Afghanistan. All of that put at risk millions of dollars that needed to go towards care. So the military tonight is promising, number one, they will not allow there to be a shortfall in the funds for military healthcare. And number two, they say if any soldier, sailor, or airman and woman is charged for seeing a doctor, and one hospital in particular was threatening to do this, that they will make sure that bill is covered. Nobody will pay out of pocket for their bills, and that they will make sure that the military healthcare budget stays on track.